Hey there, Dr. Brian McKay, not just a chiropractor, stand for Darien, Norwalk, New Canaan. Today, welcome to Clarity Before Care. We're going to discuss thermal imaging and nerve sensitivity. I'm going to explain it. Now, what's Neuropathy CoreHealth? Neuropathy CoreHealth is, I guess, is a separate project within the practice here at CoreHealth. And what we've done over the last dozen or so years is we have kind of mastered the art of helping people reverse, not cure, reverse some of the symptoms that they have with peripheral neuropathy. And as you probably well know, if you have peripheral neuropathy, it's numbness, tingling, loss of balance, little wobbling on your feet, night pain. Like sometimes people say they have the bugs are crawling up their legs. So it's a complex issue. Usually it affects, what happens is the nerve, well, for many reasons, can start to dumb down or even starts to die. There's a covering on your nerve called the myelin sheath. It allows for speedy transmission of nerve impulses along what we call the nose of Ranvier. Don't need to know, I guess it's too much information, but it's the only way I know how to explain it. So what happens is if you have poor glucose regulation, if you're diabetic, if you're an alcoholic and you drink too much, the sugar and the alcohol will deteriorate that myelin sheath as it does for too much glucose or insulin sensitivity with diabetics. Now, if you had the misfortune of having chemotherapy, that's another potential spot there because the toxicity of the chemotherapy can eat away and kill that off. And so what happens typically is people are going to go to their doctor. They're going to say, oh, you got to go to the neurologist. You go to the neurologist. The neurologist says, well, we're going to do this needle EMG. Needle EMG is a very painful test. Or they actually do a punch biopsy where they take a piece of the muscle out and they examine it and see how if there's conductivity in the nerves. So painful and expensive, yes. If you're on Medicare, then Medicare would cover it, but still painful nonetheless. So what we started doing here is we started making it very easy for you to get a baseline and about your peripheral neuropathy. Because you need to, if something's numb, it's not pain. Pain's your motivator, okay? Two types of nerves, A delta and C fibers are the typical nerve inputs, okay, that go to your spinal cord all the way to your brain, and the pain is perceived in your brain. So if you're not getting enough nerve information to your brain, it's if you still remember what it's like when you leave a phone off the hook. Back when we were a lot younger, the phone gets left off the hook and bing, it just keeps buzz, buzz, buzz. You could be in the backyard, you can hear that thing buzzing till you go and shut it off, or till you hang the phone up. But the brain is looking for information, it's not getting it, and it's not getting it fast enough. Peripheral neuropathy can ensue. All right, so those are your main reasons. I mean, some people you can also get from infections, a little bit more rare, but it does happen. So what we came up with is we came up with a very simple two-pronged test. We do a thermal imaging scan. It's a quick scan that maps skin temperature, and it gives us a clue about blood flow. If you don't have enough blood flow, okay, to your feet, how's the nerve supposed to survive? Every nerve needs a couple of things. It needs stimulation, okay? And if you're a little wobbly on your feet or it hurts to get up and walk or you have leg pain, you might be sitting down way too much, which decreases blood flow. So blood flows are important. You need oxygen, okay? You have to have oxygen for a nerve to survive. You need nutrition. You need the right supplements. You need not be drinking Coca-Cola. You need not be drinking too much booze either, because this is, again, going to affect the nutritional level of the nerve, okay? Now, so this nerve stimulation, blood flow, oxygen, nutrition. Those are the key core elements of what Neuropathy CoreHealth has our patients doing, and we have a pretty good track record, okay? We're not going to help everybody. Let me tell you something. I've had people come in here about to lose their foot. No, you're not going to be a patient here. It's too far gone at that point, and it does happen. So we have the simple thermal imaging scan. It's just, you will see, as soon as I see, if you're getting enough blood flow to your feet. Very simple. Very, very simple. Now, the nerve sensitivity test is a couple different ones. One, I'm going to write a number on your foot. The nerve impulse should travel at almost 280 miles per hour. So you got to think, as soon as I write a number on your foot, you should be able to tell me what the number is. Now, if you can't, that test is called graphesthesia, okay? And it's very easy to tell if you don't have it. If I write the number 4 and you can't tell me what number I wrote or not anything at all, there's a digispan test where we ask you, okay, if I touch the big toe and the small toe, how many toes are between it? You would say 3. These are little simple tests. Then we have 2-point discrimination. Am I touching you with 1 finger, 2 fingers? As we go up and down the leg. Very simple test to tell you if you have loss of nerve sensitivity. And because sensitivity could be numbness, you're not aware of it. Because you go, okay, well, or you may elect to take the Lyrica, Cymbalta, and gabapentin that most people do take. So these tests can give you a baseline, and it helps us talk honestly about what next step. I mean, some of the people come in here live too far away. I'm practicing in Darien, Connecticut. Some people have to come in once a week for 3-4 months. Other people can come in once a month for 6 or 7 months. But they basically is everyone has to do home routines. And by the way, you really should be doing home exercises to help you balance. And if you want at the end, I'll include a link where you can go download the neuropathy exercise I prescribe to every one of my patients. But again, let's get back to the clarity before care. Thermal imaging and nerve sensitivity explained. So what you got to have is you have to have a realistic expectation about what you can do. Because I don't cure neuropathy. What I do is I give you a fighting chance for your body to overcome these symptoms and start to reverse out so you don't do further damage and you don't end up like the poor guys who end up with legs amputated or feet amputated. And it does happen. So this is the type of stuff what we want to instill upon people. So what I ask you to do is in this podcast, I'm going to have a link where you can click and download the exercise protocol. Very simple. It's very easy to follow. It'll be based on more balance because the balance is very, very important. Because if you're losing balance, you're probably not aware of it. And we all know if you lose balance, it's way easy to fall. You fall too often, you're going to end up in the nursing home, and some people don't come out of the nursing home. Let's not have that be you. So basically, what we've done is you have the opportunity to come in and get the thermal scan and the nerve test for $47. Now, it's going to take 15 minutes. There's no pressure. I'm not selling you anything. I'm going to give you a baseline. You want more information? You take it from there. But please do the exercises. They'll be in the description below this podcast, and let's take it from there. All right. I'm Dr. Brian McKay. This is Neuropathy CoreHealth, and yes, I am just a chiropractor. Well, maybe when we do a little bit more than just chiropractic. But we're here to help, and we're also here to educate. If you take advantage of this, you come in $47 thermal scan. It's usually $195. You're going to leave with a lot more information. I just urge you to, if you're married, bring your loved one because we're going to do these tests. You'll see, and I'll know that I can also help you avoid getting any worse. So, Dr. Brian McKay, thank you for listening. Have a great day, and talk to you soon.